Late in pregnancy, it can be pretty tricky to tell the difference between amniotic fluid and urine. Amniotic fluid is usually clear with white flecks and has no smell, plus it can soak through your underwear. Urine, on the other hand, is yellow and has an odor. So, amniotic fluid is like this warm cushion that protects and supports your baby while they grow inside you. It contains things like hormones, immune cells, nutrients, and even your baby's urine. At its peak, there's about a quart of this fluid in your belly, but after 36 weeks, it starts to decrease as your body gets ready for delivery. When your doctor does ultrasounds, they check how much amniotic fluid is surrounding your baby. Sometimes, a little fluid might leak out. If a lot leaks, it's called oligohydramnios. And if it gushes out, that's usually because the amniotic sac has ruptured, basically, you're water breaking. But here's the thing, it can be tough to know if the fluid leaking is amniotic fluid or something else. Amniotic fluid is usually clear, might have white flecks, or be mixed with mucus or blood, and it doesn't have a smell. It also tends to really soak your underwear. Urine, though, has a smell, and vaginal fluid is usually white or yellow. If you're not sure, you can try this: empty your bladder first, then use a pad or panty liner. Check it after about 30 minutes. If the fluid is yellow, it's probably urine. If not, it might be amniotic fluid. You can also try squeezing your pelvic floor muscles like you're trying to stop peeing. If no fluid comes out when you do that, it's probably urine. Now, leaking amniotic fluid isn't always safe. If it happens early in pregnancy, it could lead to things like birth defects, miscarriage, or premature birth. Later on, it might cause problems during labor or increase the chances of a C-section. Here's when you should definitely call your doctor. If the fluid looks green or brownish yellow, that could mean your baby has had a bowel movement, which can cause breathing issues after birth. Or, if you think your water has broken, you should tell your doctor what the fluid looks like and likely head to the hospital. Don't worry too much, though. Your body replaces about a third of your amniotic fluid every hour, so your baby won't be left dry. But if your membranes have ruptured, it's important to get checked out since delivery might be close, or there's a risk of infection.